We are now going to investigate the glands of the gastrointestinal system that allow us to actually digest our food and mobilize it for absorption by the small intestine and elimination by the large intestine. Very prominent in that process are the liver, the gallbladder, just peeking out here, the pancreas tucked posterior to the stomach, and even though it's not a digestive organ per se, we're going to discuss the spleen a bit here on the left side. But before we get to any of those, we actually have to return to the head and neck and look at some of the digestive glands that are present up there, namely our salivary glands. The salivary glands are the first glands that aid us in the process of digestion, and they're going to moisten the food as we chew it, but also begin the process of chemically digesting it. Here is the location of the parotid gland, and it's typically quite a bit larger than is demonstrated in this model, but the parotid gland releases a bit of watery saliva through its duct. Now, all these salivary glands are what are called exocrine glands, meaning they release their products through a duct, and in this case it's going to pierce the cheek and empty into the mouth. So the parotid duct enters there. Here, inferiorly on the mandible, we can see the submandibular gland, and it also has a duct on the inside of the mouth that's going to empty alongside the tongue. Now, there are other glands as well, but to see those, we're going to actually pan back up here with the most fancy camera work I've managed to trust myself with so far in these videos. And here, we have the submandibular gland, and its duct comes across this muscle, the mylohyoid, but comes across it and empties here just in front of the tongue. So we have the frenulum, or the kind of link of the tongue to the bottom of the mouth here. Then we have the opening of the submandibular duct on either side. And it's not uncommon for kids on the schoolyard to learn to do a little spitting cobra activity with that, and that is the submandibular gland and its duct releasing saliva. The third salivary gland is called the sublingual gland, and it's here just below the tongue, as its name implies. And instead of one duct, it has many ducts opening into the area between the teeth and the tongue. So those are the glands of the head and neck that help us with salivation. Now, in the esophagus and throughout the rest of the digestive tract, there are microscopic glands releasing mucus, releasing digestive enzymes, and things of that nature to allow us to help move food along and mobilize it and make it digestible. But we're only going to be focusing on the major visible glands, and to do that we're going to return to the abdomen. Moving down to the abdomen, we'll now examine the liver, spleen, and pancreas in a little more detail. So we got the liver and gallbladder coming out here first from the upper right quadrant. We'll get the stomach and intestinal tract out of our way. And here we can see once again the duodenum, first part of the intestines, and the pancreas. We have the spleen here, which technically not quite a digestive organ, has a lot in common with them, especially when it comes to the blood supply, which we'll talk about shortly. So we'll remove these as well, and then we'll take a look at them individually. The liver is an incredibly complex organ with many metabolic activities as well as activities involving screening the blood, allowing us to store and release certain metabolites like iron, but also sugars. And so anatomically, we divide it into a large right and usually smaller left lobe. And these two are going to be subdivided from each other by a visible mark called the falciform ligament. Now, it's just shown here as a line, but that falciform ligament connects it to the anterior body wall. Within it is a remnant of the old umbilical vein that would be bringing blood to the embryonic heart. This is called the ligamentum teres hepatis, or round ligament of the liver, and doesn't really have much of a function in adults, but in babies and neonates it was very important in the womb. But right now it's a good marker for our left lobe from our right lobe. If we flip the liver over, and for clarity I'm actually going to turn it this way. So anterior is at the bottom of the screen, posterior is up here at the top of the screen. I'm going to zoom out just a hair so it's a little easier to see. Here, once again, we have our right lobe and our left lobe. And the right lobe has two subdivisions. This is going to be the quadrate lobe and the caudate lobe. Now, the caudate lobe is more caudal, hence it's a little more posterior, and it's next to the inferior vena cava. The quadrate lobe here is between the falciform ligament and the gallbladder. So the gallbladder is going to be a very important organ. What it's going to do is going to receive bile from the liver. Now we'll talk about that in just a second, but before we do, I want to draw attention to the fact that this bile is being drained to a duct, but alongside it we have an artery going to the liver, as well as a vein, the portal vein, going to the liver. These three structures are entering here at what we would often call the hilum in some organs, but in the liver we call this the porta hepatis, and these three structures are often called the portal triad because they stick together at the macroscopic level and even at the microscopic level. So we'll often find an artery, a vein, and a bile duct present at all levels within the liver. Now, since this is on the right side, we have an impression of the right kidney sitting just here, whereas on the left side we have an impression of the stomach present here. Now, we talked about the gallbladder, and typically it doesn't really show up much. It's just kind of peeking out underneath the inferior border of the liver in the upper right quadrant. But looking at it, what I want you to note is that it's connected to ductwork from the liver. The liver creates bile, but the gallbladder stores bile and then releases it when we need to digest a fatty meal. So here, the liver releases the bile into a left and right hepatic duct. These fuse to become the common hepatic duct. Now at this point, the bile will drain into what's called the common bile duct, and that's going to take us down to the duodenum. When we're not needing that bile, a sphincter in the duodenum contracts and the bile backs up. But instead of going into the liver and eventually causing jaundice, what hopefully it does is travel to the gallbladder through the cystic duct. And the gallbladder is where it is stored, and that's where it's going to be able to hold that bile and concentrate it until we need to digest a fatty meal. Before we move on to other glands of the digestive tract, I want to just follow that flow of bile a little further like we did earlier. We saw that we have the common bile duct here on the posterior side of the duodenum. It's going to enter the second portion of the duodenum here at the major duodenal papilla, and it shares that papilla with this large main duct of the pancreas. Now the pancreas is interesting in that it is both an endocrine organ, releases some substances into the blood, and an exocrine organ, releases some substances into the ducts that then move to the duodenum. The exocrine pancreas releases digestive proenzymes that get activated when they hit the slightly acidic environment of the duodenum, and the pancreas, we flip it here, is described as having a head here that's kind of surrounded by this C shape of the duodenum. So we have the pancreatic head here, along with some of the vessels that are traveling to the gut. We flip it back, and then there's a relatively slender pancreatic neck here in the vicinity of these vessels, pancreatic body, and just about here we get the pancreatic tail. Now this one's being shown a little larger than usual, but the pancreatic tail does often contact or just touch the tip of itself to the spleen on the left side of the body. Now the spleen is interesting in that if you really forced my hand, I would say it is more of an immune organ than digestive, but the trick is it is a little bit of a digestive organ if you broaden the definition to it digests old and fragile red blood cells and then puts their iron and heme groups back into circulation where they're carried to the liver. So it shares some of the blood drainage and blood supply with the digestive organs, although it itself has more immune function and screens the blood for antigens, viruses, bacteria, more so than it is strictly a digestive organ. The spleen, however, is located on the superior left quadrant of the abdomen and can be badly damaged by fracture of the ribs because the ribs are basically sitting on its outer surface here. On its posterior surface, there's an impression for the left kidney, and it also is right next to the stomach. So we'd have the fundus and some of the body of the stomach pressing on the spleen here as well. Well, we haven't made disease processes one of the major topics in these videos since they are introductory anatomy videos. I just can't resist going into the biliary drainage system and a very common problem, and that is gallstones. So here, once again, we have the bile produced in the liver going through the left and right hepatic ducts to the common hepatic duct. That bile then travels down the bile duct or common bile duct into the second part of the duodenum, and it joins the main pancreatic duct here in this ampulla, hepatopancreatic ampulla, and there's a hepatopancreatic sphincter here that can close when we don't need to digest, and that causes the bile, which is constantly produced, to back up. Now, if it goes into the liver, it can eventually force itself into the blood, traveling through the liver, and cause jaundice and problems. So instead, we hope that it travels to the gallbladder through the cystic duct. But as the gallbladder concentrates and kind of stores the bile, sometimes it can crystallize and we can get gallstones of varying sizes. They may lodge or stay in the gallbladder, but they can also block its neck and, in some circumstances, can block the common bile duct, causing bile to back up into the gallbladder and eventually the liver. And if we're very unfortunate, they can lodge in the hepatopancreatic ampulla, at which point we've not only blocked the flow of bile into the duodenum, we've also blocked the release of digestive proenzymes into the duodenum. And this can cause inflammation of the pancreas or pancreatitis, and, not surprisingly, is quite painful. Returning to the abdomen, we're going to remove the liver and stomach here. Dun, 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 dun.